What if I told you that right now, an AI system can spot cancer in medical scans faster and more accurately than some of the best trained radiologists on the planet, and that's not science fiction, that's happening in hospitals today. We're living through the single biggest transformation in medicine since the discovery of antibiotics, and most people have no idea how fast things are moving. In the next few minutes I'm going to show you 5 ways artificial intelligence is completely reshaping healthcare, from the moment you walk into an emergency room to the pills you might take 10 years from now. Some of this will genuinely surprise you. Welcome back to Zero Index, where we break down the most important developments in AI and technology without the hype and without the jargon. If you're new here, consider subscribing because you're going to want to stay updated on this stuff. So let's get into it. Number 1, AI is revolutionizing how doctors diagnose disease, especially when it comes to medical imaging. Think about what a radiologist does all day. They're staring at thousands of X-rays and CT scans and MRIs, looking for tiny abnormalities that could indicate cancer or a dozen other serious conditions. It's exhausting work and humans make mistakes, not because they're bad at their jobs but because we have biological limits. Our eyes get tired, our attention drifts, we miss things. Now here's what's incredible: when radiologists work alongside AI tools, they detect lesions 26% faster and they find nearly 30% more cases that they would have otherwise missed. In some studies, AI systems are achieving up to 90% sensitivity in detecting conditions like breast cancer, which actually surpasses traditional radiologist accuracy rates in certain scenarios. And this isn't some experimental technology sitting in a research lab. 90% of healthcare organizations report at least partial implementation of AI tools for medical imaging right now. In fact, 76% of all AI-enabled medical devices authorized for sale in the United States are used specifically in radiology. Companies like Google Health and Microsoft with their MAIDXO system are already outperforming expert radiologists in early detection of diseases. Think about what this means for you personally. The next time you get a scan, there's a very good chance an AI is helping your doctor catch something that might have been missed 5 years ago. Number 2, AI is transforming emergency care and clinical decision-making in ways that are literally saving lives through better triage. When you show up at an emergency room, someone has to make a quick decision about how serious your condition is. Are you having a heart attack or are you having a panic attack? Do you need immediate surgery or can you wait an hour? These decisions used to rely entirely on human judgment under pressure, and in a busy ER that's an incredibly difficult thing to get right every single time. Now hospitals are using machine learning tools that analyze your symptoms, your medical history, and your real-time vitals all at once. In 2025, emergency departments using these ML tools for triage prediction saw a 26-minute improvement in average wait time. That might not sound dramatic until you realize that 26 minutes can be the difference between life and death for someone having a stroke. There's a mid-sized American hospital that integrated an AI triage solution directly with its electronic health record system, and it correctly identified high-risk patients who might have otherwise sat in the waiting room way too long. Beyond the ER, AI-driven patient stratification models improved outcomes for type 2 diabetes patients by 21%, and predictive models reduced delayed surgeries due to pre-operative complications by 19%. These aren't marginal improvements, these are significant gains that affect real people every single day. Number 3, AI is accelerating drug discovery in ways that could completely reshape how quickly new treatments reach patients. Traditionally, bringing a new drug to market takes about 10 to 15 years and costs billions of dollars. Most drug candidates fail somewhere along the way, and the whole process is painfully slow while people are waiting for treatments that could save their lives. AI is changing the math here dramatically. The AI drug discovery market is projected to reach $4 billion by 2028, growing at a compound annual growth rate of over 40%. That kind of investment doesn't happen unless the technology is actually working. Machine learning accounts for about 41% of AI methods being used in drug discovery, with molecular modeling and simulation making up another 21%. And oncology, which is cancer treatment, accounts for nearly 73% of these studies because that's where the need is most urgent and where AI can potentially make the biggest difference. What AI does is analyze massive datasets of molecular structures, biological pathways, and clinical trial results to identify promising drug candidates much faster than human researchers could on their own. It can predict which compounds are likely to be effective, which ones will have dangerous side effects, and which patient populations are most likely to benefit. This doesn't replace scientists, it supercharges them. Number 4, AI is tackling one of healthcare's most frustrating problems, which is the mountain of administrative work that drives up costs and burns out medical professionals. Here's a number that should make you angry: doctors and nurses spend an enormous amount of their time on paperwork instead of actually caring for patients. Documentation, billing, scheduling, insurance claims, all of this administrative burden takes time away from medicine. AI is estimated to reduce administrative costs by $20 billion annually in the United States alone. 80% of hospitals now use AI to enhance patient care and workflow efficiency. AI-driven chatbots are expected to save the healthcare industry $3.6 billion globally by 2025 just by handling routine patient inquiries and appointment scheduling. But here's something really cool that doesn't get enough attention: AI tools can now auto-recommend clinical trial matches based on electronic health record data with 82% match precision. Think about that. If you have a condition that might benefit from an experimental treatment, there's now an AI that can scan your medical records and tell your doctor about clinical trials you might qualify for. Previously, most patients never even knew these trials existed. Number 5, and this is the big picture point: AI in healthcare isn't slowing down, it's accelerating faster than almost anyone predicted. The global AI in healthcare market was valued at nearly $19 billion in 2024 and is expected to grow at a compound annual growth rate of over 38% through 2033. That's explosive growth. 89% of healthcare executives in 2025 report using AI in at least one clinical or operational function. But the stat that really shows how fast things are moving is this one: nearly 2/3 of physicians reported using healthcare AI in 2024, which was a sharp rise from just 38% in 2023. That's almost a doubling in physician adoption in a single year. When doctors themselves are embracing a new technology that quickly, you know something fundamental is shifting. We're not talking about some distant future where AI might eventually help with healthcare. We're talking about right now, today, in hospitals and clinics around the world. So what does all this mean for you? It means that the healthcare system your children grow up with is going to be radically different from the one your parents knew. Diagnoses will be faster and more accurate. Emergency care will be more efficient. New drugs will reach patients sooner. And doctors will have more time to actually be doctors instead of data entry clerks. Of course, there are challenges ahead: questions about privacy, about algorithmic bias, about who's responsible when an AI makes a mistake. These are serious issues that we need to address. But the potential benefits are too enormous to ignore, and the transformation is already well underway. If you found this valuable, hit that subscribe button and turn on notifications because we cover these kinds of developments every single week here at Zero Index. Drop a comment below and let me know which of these 5 areas you think will have the biggest impact on your life. And I'll see you in the next one.